Hi, my name is Dr. Wellens and I'm here to talk to you about extracorporeal shockwave therapy or orthotripsy. As you probably know, there are a lot of FDA findings that find that cortisone injections can long-term have some side effects that are very negative for our body. So I get a lot of patients who come and see me for different musculoskeletal issues, and they're looking for alternatives to cortisone injections. Extracorporeal shockwave therapy had been around for over 20 years and is basically a transcutaneous, meaning skin application of high energy acoustic waves in order to break down the tissue that is diseased and promote healing. It causes revascularization as well as reduces pain and swelling around the tissue. And it had been utilized in Europe for over 20 years. It became very popular in the United States about 15 years ago, and insurances used to cover it, but unfortunately, due to many political reasons, there were some studies on very small population groups that were published that showed that it was not as effective as it was originally predicted. So insurances stopped covering it, and it kind of went away for a while. But we do know that surgery should always be the last resort, and that's why I always recommend that my patients try everything non-surgical before they proceed with the next step. That's why extracorporeal shockwave therapy is phenomenal for plantar fasciitis, Achilles tendonitis. They use it for tennis elbow quite a bit. A lot of my orthopedic colleagues always ask me about shockwave and how much of success I see in my practice, and I can tell you is 85 to 90% success rate is what I usually quote to my patients. There are also other indications such as non-unions, malunions of fracture healing conditions, and in fact, it's interesting enough, but FDA originally looked at extracorporeal shockwave therapy as an indication for non-unions of fractures. There were also multiple studies that were published for wound healing because, as I mentioned before, revascularization is one of the wonderful effects of shockwave therapy treatments. And it's non-invasive. Sometimes we do have to anesthetize patients depending on the condition and also the severity of the condition. But the beautiful thing is you do not need a cortisone injection, and it's completely non-invasive. It's not a surgical technique. It is something that is done in the office, and usually it's 3 to 5 sessions, approximately 1 week apart. So if you have tendonitis, plantar fasciitis, any type of musculoskeletal issues, and you either already tried cortisone injections or you want to seek the alternative treatments prior to scheduling surgeries, I think that orthotripsy is a great way to try everything non-surgical first. And the success rate of 85% is pretty high, considering that most medical conditions and treatment success rates are anywhere between 60 and 70%. So call the office, schedule an appointment. I will be more than happy to evaluate you to see if you're a candidate for extracorporeal shockwave therapy treatment or orthotripsy. And of course, I always encourage my patients to do their homework, and there's so much wonderful information that is published online about this non-invasive technique that is completely safe. But talking about safety, I can tell you is that if you're pregnant, if you have any type of blood clotting disorder, or you're on blood thinners, that would be the 3 contraindications for the extracorporeal shockwave. So again, call Central Florida Foot and Ankle. I'll be more than happy to evaluate you and see if you would be a candidate for orthotripsy.